Okay, and we are live. Ladies and gentlemen, good afternoon or good evening, wherever you find yourself. This is the Fleri Care Digest, episode 5, and we are honored to have with us today Dr. Ismail D.Badije, founder, CEO of Innovarx Global. Innovarx is a very interesting company, and I will dive into that in a bit. But Doc, it's a pleasure to be here. It's always been an amazing time speaking to you, and I'm really excited for everyone else to discover the good work that you've been doing. We often tend to gloss over it, especially when we talk about healthcare, the startup scene within West Africa. So super excited to have you here. Um, Kindly do us the honor of introducing yourself.
No, thank you, Sam. You're generous with words, but I appreciate and equally admire the work and the mission that you've embarked on. And I think there's so much alignment from the first day that we spoke. So anytime we get a chance to connect, like you said, our hearts are aligned, and I think our vision for Africa is aligned as well too. As you mentioned, Ismail is my Gambians may say Ismaila. My U.S. friends may say Ish, same name. I was born in the Gambia, but raised in the USA and also in the Gambia. So I've lived between the two countries, mostly in the USA as well too, but spent a lot of my formidable years in Gambia from 7 to 17 in particular as well too. Professionally, I am a pharmacist. That's something that's very important to me, very passionate about the profession. So spent a lot of time working in communities in rural and urban USA. And even today, everything that Innovarx is a reflection of my experience as a community health provider, just mixed with a level of entrepreneurship, trying to tackle one of the biggest, I guess, mammoths on the continent, but honestly around the world, when it comes to how could you democratize access to quality healthcare across the world. So yeah, pleasure being here. I'm looking forward to an engaging conversation.
So I will say this, you're extremely modest in your introduction, but there are a number of facets to you, and there's a reason why the Fleri Care Digest and the work that you do uh, really comes together in this way. When we started Fleri, one of the things that we realized was this gap, right? This lack of insight into who's actually doing what when it comes to healthcare on the continent.
Mhm.
In one of my conversations very early on, I'd spoken to a doctor who lived in Chicago for about 32 years, originally from
Mhm.
Nigeria, right?
Mhm.
And his first response to me telling him about Fleri was, there are care providers that provide quality service there. I wouldn't even let my family go to a hospital there. And in the moment, he blurted it out, right? Not really thinking about being a Nigerian doctor and what the implication of that is if anybody else is listening, right? But also the amount or the ease with which he dismissed an entire set of doctors who had stayed behind, and the privilege with which some of us seem to express the option of leaving the country to go get care somewhere else, but it will never be a sustainable solution. So when I came across the work that you were doing way before we had even started, right? You had tackled a country that most people don't really look at as an investment, from an investment standpoint, worth investing in. And then, two, you take a field like healthcare, right, which requires long term patient capital to be able to yield results. And then, three, you drive innovation for a group of people who are very familiar with hospital based care, right, and start mobile delivered care for the affordable masses. It takes a lot to be able to do that. And given your history, your own experience with the political scene there, I wanted to understand what motivates you and what drove the decision, right, to start Innovarx and approach all of these things that I've listed out?
No, yeah, thank you. And I think it's always an important facet, I guess, to note that Innovarx, the concept happened pre-pandemic. Even though our model, if you look at it from the outside, it looks like a pandemic influence healthcare model, but it's never been a professional journey for me. It's always been a personal journey. I tell people healthcare is difficult. That's why a lot of people stay away from it, especially in Africa. It's easier to sell commodities. Nothing wrong against selling commodities, but products typically are easier to even quantify than services, especially in a land where there's a scarcity of human resources. That's one. But I always tell people about my why. Living in the USA, before I moved back to Gambia when I was young, we moved, and then a year later, my grandmother died. She was 56 at the time. She died from hypertension and diabetes that was uncontrolled. At the time, I did not understand it. I was too young. I did not understand how unusual it was for a woman to die at 56. But as genetics goes, my mom also is diabetic and hypertension. And I got to realize her disease progression as an adult from a vantage point of a healthcare professional, because I was a pharmacist. But not only that, I was diagnosed with hypertension when I was 28. So, which is not unusual, because most of the times, if your grandmother has non-communicable diseases, your parents, one of them will probably have non-communicable diseases. But as a healthcare professional, the moment I was diagnosed with a disease that I have to live with for the rest of my life, there was no anxiety around it, because I'm like, okay, it's 20 something, right? I was 28 at the time. I'm a healthcare professional. I have access to quality medications. I know how to monitor all the other variables in the disease. But I always take it back to, not from a place of anger, but from a place of despair, thinking that if what Innovarx is existed in 1994, my grandmother had a higher chance of us getting to know her as her grandkids. It's not even unusual for certain countries for them to see their great-grandchildren, meaning if she lived to be alive today, she could have met my daughter, who's 4 years old. So much of the conversation around healthcare, especially in Africa, it's easy to label it as a healthcare problem. But I think that lack of healthcare has robbed Africans more human experiences that we'll ever be able to quantify. It's not like our history is written anyways. So the fact that I did not get to know my grandmother is because of healthcare. At the root of it is something as simple as, okay, you need quality medication every single day. You need somebody who's knowledgeable to kind of tell you something about your disease. Because it lacks, Africa is now a place where Africa has more widows than any continent in the world. Africa is now a place where 1 in 3 men would not live to celebrate 70 years old, right? So the moment I acquired a level of proficiency, the dream for Innovarx started when I was in pharmacy school, because I went and visited Gambia and realized, okay, it's unusual in this day and age of technology for it to be like a 50-year gap between where healthcare is in Africa and the healthcare that I've been trained to do in the USA. There has to be a way to leapfrog a lot of the challenges, and then just took it from there. So I think Gambia also, I'm honest about the fact that with any idea, you need a proof of concept ground. You need to prove that this solution could work. And Gambia, as unattractive, unsexy as it is from a business standpoint, if somebody gave you as a creative entrepreneur a blank canvas of 2.5 million people and the variables that you could control, there would not have been a better place to start off Innovarx than Gambia from an experimentation standpoint. And then all the goodwill of actually impacting change in the way people receive healthcare is just byproducts of the solution, but it's always been personal. So at the core of what we do, our why will always be rooted of how many grandmothers like my grandmother do we have the opportunity to give them a chance to get to know their grandchildren. because how healthcare is delivered is going to change. How we do it is going to change. What we do is going to change. But why we exist will always be rooted in that core human element.
I really appreciate the long-term view that you take, as well as the very personal nature of your commitment to the solution. It's not going to be possible for us to solve a lot of the challenges that Africa faces today without very similar commitments that are motivated by something that goes beyond a return over a 10-year period. This is also the reason why we see the current funding landscape, skewed and geared towards what is the quickest return, or what is the quickest visible, return. Venture capital will most likely not solve our healthcare issues. Venture capital will probably not solve our education issues. Venture capital will probably not solve our agricultural issues. And the reason why these three form the basis of any economy that is able to scale up, empower its people, or to be able to develop with some semblance of dignity, process, and operational aptitude, is because if the people aren't healthy, throw everything else out, right? The model doesn't work. If the people can't feed themselves, then they're constantly searching for ways to feed themselves. And so they become short-sighted. Again, the model will not work. If the people cannot be educated, then it's even worse, because one, you don't get the attitude, then you don't get the aptitude, and then you don't get the motivation, right, to actually want to fix any of the other things. I think it will require us, and coming onto that, especially those of us who've had the privilege of being educated and seeing systems that work, right, to be able to understand the sacrifice that it really takes to get back and then build in this particular way. So I really respect the amount of thoughtfulness and work and commitment that you put towards making this work in a country like Gambia. But I'm also very sure that it's not lost on you how applicable the learnings and the solutions that you've discovered are to the rest of the continent. And I wanted to go in then and then start to ask about operationally, right? Where is Innovarx? Where is the plan to bring the learnings over the last few years to more people on the continent? And how does it apply today for the population that you're serving?
No, absolutely. And I'm so glad, before I answer that you touched on this idea of privilege. I had a mental shift where I started looking at it as a responsibility versus just a privilege, because I think that creates a sense of urgency, being that we cannot keep expecting the typical African professional experience in the USA to accumulate as much knowledge and wealth. And then when you retire, you start looking on the continent. That is a form of privilege. But I think the responsibility or the onus comes in when we decide, okay, while we have the strength, the intellectual fortitude to do it, kind of build something, right? And I think that's very important, especially when something as hard as healthcare. So to answer your question, I think we did not reinvent the wheel in terms of how healthcare is delivered. I was very fortunate to be working in community pharmacy, Walgreens, for example, at a time where there was a shift in even the USA realizing that the best way to reach as many people as possible and provide preventative care, or even healthcare that you don't need a hospital bed, is through the communities. And technology had reached a point in terms of cloud-based electronic health record systems, point-of-care testing devices, last mile delivery, where all these things had an opportunity to be executed on the continent simultaneously, which is a revolution in itself, because typically you never get simultaneous innovations in terms of models. You typically get a model that works in the USA, and then 20, 30 years down the line, a version of it shows up in Africa, where automatically people assume it's a less than version, when I think it invokes a great sense of pride to know that things like telemedicine, last mile delivery, point of care testing were something Innovarx was doing in Gambia before the pandemic hit, and actually forced a lot of US companies to pivot from the business model. So what Gambia showed us that you could literally take care of majority of the population, between somebody who's healthy and just need preventative health care to somebody who's sick enough but does not need a hospital bed. You could provide that care throughout the communities, right? And the beauty about Africa is, and this is something that we saw, Africa is the youngest continent in the world. Majority of Africans have not celebrated their 25th-year-old birthday. The average 20-year-old African does not need a hospital bed at all. But historically as well, even from a government and policy standpoint, we've championed infrastructure projects like a 500-bed hospital, that does not have enough doctors to even man it. The equipment's run out and there's no technician who could solve it. When the average African just wants to know, am I healthy? If not, what do I need to do? And not create a level of segregation in terms of the quality of care that you get, right? So you have a business model and an opportunity where we could meet a customer at 18 and keep that customer for 40 years because they need preventative health screening. They need access to quality medications. If they have a non-communicable disease like I do, what they need. That's what Gambia showed us. And from the economic standpoints of it, which is important, we've evolved past the point where investors need to see Africa's market as the local GDP. Because Africa's market is every single African in the world is part of Africa's market. And I think there's an awakening now where they realize the value of remittancy. And I'm going to use Ethiopia for an example because that's a market that we're exploring entry right now. Ethiopia has 100 million Ethiopians, right? But $4.2 billion goes into Ethiopia every single year from Ethiopians outside of Ethiopia. Average person will picture Ethiopia as scrawny kids with flies on their face, as a country that doesn't have wealth, when there's a massive inflow of money from Ethiopians all over the world. Same thing with Gambia, right? So what Gambia showed us actually was like, okay, Gambia is unattractive, but the past 3 years, over 50% of our revenue came from Gambians outside of the diaspora, because that shows you that every Gambian who had a loved one who was unwell was losing sleep because of healthcare. But no infrastructure happened where they could spend money directly for healthcare services to be provided, which is almost like the embodiment of Fleri and what you guys are trying to do across the continent, which is so important as well too. So what works in Gambia, not only can it work in every African country, Innovarx could uproot all our products and services and launch it in the USA and still be able to provide healthcare in parts of America that are still healthcare deserts, that are still ravaged with non-communicable diseases. So the idea has always been, that's why we were very intentional, even in the name of the company, to not limit ourselves in terms of what and where we could go, but just literally see how could you package tangible healthcare solutions that are not attached to a hospital bed and provide it to as many people as possible using local talent, intellect, but international technology and international resources as well too. So Gambia gave us opportunities for Nigeria. It's going to give us opportunities for a lot of countries, because we're very sure of how to execute the operation now in any African country that we have a green light in.
So this is what I hope that people take away from listening to this, right? Because a lot of people lack the advantage of time to look at the actual net effect of all of that knowledge that is gained from championing solutions within the communities themselves, right? every single African country, has the majority of its population under 25, right? And like you rightly said, so why is it that we adopt a model that is largely based on Western standards when those countries have a larger group of people who are aging? And so their healthcare, right, is modeled after the kind of care that people are getting there. And the second part is even they have realized that getting people out of the hospital and into their homes and being patient-centered is key to extending life, right, from a solution standpoint. But we haven't met the incentives, right, on the ground. 90% of healthcare projects are funded through donor countries, largely agreed to through political will, are very opaque in contracting, procurement, and execution of the actual work. And so what they've become are hotbeds for corruption. And so when you take all of these, we actually have no incentive for community-based healthcare, which can truly operate out of a mall, a shopping center, right? Places where people frequent, get the healthcare that they need closer to them. And then give them the information that they need to change their lives. We have actually not looked at it in that way. And that's the reason why for Fleri, having lived here, right, and having lost my grandmother due to the exact level of ignorance that we see in the larger part of our societies, it makes sense that the people who live here, who feel the heaviest burden of pain when there's a healthcare emergency or a need, are able to champion preventative care so that those loved ones, right, will start to showcase a different way in which people access care. They could become a model. And that's why for me, it was never about how do we duplicate or replicate the process. Instead, it was how do we bring together all of the providers who get it and are actually innovating in these places, remove the lack of access to information and trust, similar to what Airbnb did, right? Help people understand that you could travel from Ghana to Italy and you can actually stay there, right? And be safe. And that's exactly what we're doing. We're showing people that in today's world, as everybody starts to talk about how Africa is the next frontier, how do you go to Africa without being assured that your health care and your health will be safeguarded there? Where do you go when you get sick? If you leave your children there, where would they get care from? Well, there's so many people who are solving that. And we want to make it easy for you to be able to understand, discover, and pay for those services and have it be accessible to the people that you care about. So I really love, how intentional it is to be able to spearhead the change by proving it with the people who are in closest proximity to it, the people in the diaspora on that end.
No, absolutely. And the beauty is, and I think that's why going back to the responsibility, people in the diaspora know that I am of the diaspora, right? I've lived their experiences. I've lived the frustrations of sending money back home and having no idea where the money went into, having no idea the quality of care somebody received it. Or even as a pharmacist, where every single time I used to go back home, I'll get so many requests about bring me Tylenol, bring me ibuprofen, bring me metformin, bring me X, Y, and Z, where now I'm like, no, just go to Innovarx and you'll get the same ibuprofen and Tylenol that I have on my shelf here. Just little things like that as well, too. So I think And the consolidation, I think, is very important in terms of even how important Fleri is, because Africa is not at the point where we should worry about even saturation or competition, because we need 100 Innovarx Globals all over for us to get to a point to meet the demand for our services, right? Even a conservative number will tell you the healthcare market is 250 billion over the next 10 years, meaning you could have 100 companies that could exist, executing at a high level, which will increase what customers get. Yeah. And the market still won't be saturated. And I think a lot of the dormancy in innovation that has happened in Africa is because customers haven't been shown an alternative. So a lot of times, like Innovarx, somebody could see it and say, we're adding tension to the Gambian health ecosystem. Well, tension is good because everybody in the ecosystem will now know that it's not good enough to give somebody medication in a piece of paper. And when they could go to Innovarx and the bottle is going to have their name, it'll have instructions, it'll have the expiration date, right? So I think Africa is a unique opportunity ahead of us, but also we need to police the quality of characters that have access to the ecosystem, because that's extremely important as well too, for our people to understand that, healthcare professionals with good intentions are behind a lot of the solutions that are being deployed, and it's not from an exploitative manner, or it doesn't come with conditions like a lot of the honesty donor money as well too, which typically never touches the private sector. Yeah. Because most of the governments, unfortunately, the problem is the commodity that gets them the funding. So I don't think there's an intentional effort to get rid of the problem, because then what becomes a commodity? So you have a lot of times where companies like Innovarx or even companies across the African continent have solutions that could be deployed at scale, but they don't have access to a lot of government resources as well too. So it's almost like you're competing with governments in most ecosystems, or regulations just make it really difficult for it to be a hotbed of innovation, which is one of the, I guess, the most unique things about being a new solution that could do a lot of good in Africa compared to a new solution that could do a lot of good in some Western countries.
Yeah, that's a really, really strong point, right? And a number of things come to mind when I look at my own homeland, Ghana, and then you look at the evolution of M-Pharma, which I think is one of the most phenomenal healthcare businesses to have been built on the continent over the last 10 years, right? M-Pharma has largely done that without a lot of government support, right? And it is not uncommon, as you look at the entire health ecosystem of players who are innovating, creating, and how difficult access is to capital, right? When truly, if we harnessed all of the solutions that existed, and I could call off the top of my head the number of different solutions in different verticals, right, that people are focusing on, from ambulatory care, primary healthcare access, affordable health insurance, mobile health solutions, caregiving, in-home. Like, there's so many people fractionally trying to build solutions to what is a multi-billion-dollar market, right? And everybody is trying to piece together what they can, chasing the very small, growth, because affordability has always been a challenge, right? And so for us, one of the biggest hurdles that Fleri is going to have to overcome is, how do we create sustainability, right? From a goal standpoint, we aim in the first 2 to 3 years of our engagement with any provider, right, to be able to account for 20 to 30% of their overall revenue, right? We also are focused on becoming a liquidity partner as you look at the kind of crunches that folks are experiencing on the ground, right? What happens to the currency fluctuation when we see it in that way, right? We aim to be able to pay our providers in dollars, right? And today we do that because most of our providers now have access to US dollar accounts. So you start to understand the implication of that. While the currency is fluctuating, they experience a level of stability that they never had previously, right? Also, being able to highlight, right, in forums like this, in other events, right, the quality of the people who are building the solutions. Because we often tend to hear a lot of people, dismissively when we start talking about, well, we partner with the entire health ecosystem in the countries that we're active in to be able to bring quality healthcare to your families, right? And then the first thing that people cheekily say is, what kind of quality care would they be giving, right? And I turn back and I say, well, what kind of quality would you deliver in a job as someone living in a diaspora with the experience that you have, right? We need to be able to see ourselves building these solutions and trust that, well, if he's coming from Purdue, then I understand that he has some degree of quality, right, that he's bringing to the market. And we should support to be able to do that in that way, right? So I really, really appreciate that. Before we jump into the actual plan and the breakdown of it, I wanted to ask, if you could give us maybe a high level, go into as much detail as you can, right? Today, for a Gambian that's living in Seattle or living in DC, right, with family in Baddoo and family throughout the country, what is the experience that they get the moment they get that plan for them? Walk me through the onboarding for the new family member, the way that they actually access care, what the delivery mechanism is, and how information feeds back to that sponsor who's in the diaspora.
No, absolutely. And I think one of the things that we were so intentional in the beginning of doing as a company was making like the basic screening for individuals free of charge in the entire country. Somebody's blood pressure, somebody's blood sugar, somebody's body mass index. I think if the entire society could just have those three metrics, it's almost like the low-hanging fruit of assessing how healthy you are. So with most people in the diaspora, even before we offer you a product that's cyclical in nature in the form of a care plan subscription, the first thing we do is, if you love somebody, find out how healthy or not they are. So even with the care plan structure, the first interaction is coming in to get a comprehensive wellness screening, which is more like a 14-point exam that gives you a very objective assessment of this is where they are today. And then you could stratify them into a bucket. If they are healthy, only thing you need to do is give them access maybe to a product like a health savings account, where if they need acute stuff, they could purchase it and it's a safe delivery. Or if they have a chronic condition like diabetes and hypertension, they are immediate candidates to onboard them onto our care plans, right? And going back to the care plans, we reverse engineered what somebody needs anywhere, irrespective of anywhere they live in the world. If you have a non-communicable disease like diabetes, hypertension, high cholesterol, what are the key essentials of your care, right? And we normally put it in three buckets, right? Your clinical management, which has to do with your labs, your routine checks, having access to a nurse that could provide education, right? Having access to a primary care doctor that even if you can't come see them, our nurses will go to your homes and have a telehealth session with a doctor who's at the main facility. So that's one bucket that comes with the care plan assessment, right? And because we're leveraging technology in a way that's revolutionary in the Gambia, the moment a nurse anywhere in the Gambia even checks your blood pressure and puts it into our electronic health record system and hits send, you, the sponsor, automatically gets a report detailing the encounter. So there's an instantaneous feedback loop, which only increases the trust between us and the care plan members. And it allows them to get an honest assessment of what is going on. So it's a direct exchange for what their money for value, right? The next component is the medication therapy management. And that's near and dear to me because I'm a pharmacist, but also I understand that even in the USA, 40% of the prescriptions that the doctors write never get filled at a pharmacy. So you could have the best doctor, you could have the best lab, you could have, but if you cannot ensure that grandmother is taking her cholesterol medicine every single evening like she should, everything that you did before goes to waste, right? Not that is the most,
it's so key. Yeah.
right? It's key. It's key. And if you think about healthcare from an African standpoint, it's so fragmented that typically just to get a prescription, a pill to take, you have to go to a lab, that's another entity. You have to go to a doctor, that's another entity. You have to go to the pharmacy, that's another entity. And then you roll the grenade in the pharmacy where half of our medications on the continent may not even pass quality control in a Western world. So there's so many places where things could go wrong, where our care plans insulates not only the patient, but provides that instantaneous feedback loop to the sponsors in the loved one, the sponsors in the diaspora. And I think for me, it's always been extremely powerful for us to be delivered the same pill as somebody who picks up a prescription in New York, Atlanta. The same pill is being delivered to a village 2 hours away from the city in the Gambia to ensure that somebody's loved one gets the same health outcome. Because as most people in the industry know, that medications from a generic standpoint are not expensive. There's things around the system that makes it extremely expensive. And now even in the USA that we're seeing the Mark Cuban, drug cost program, and launching their RX Pass, right? It's laughable to me because it's information we always knew, but it's a golden opportunity that we saw from the beginning. And we actually launched a product exactly like the RX Pass that Amazon launched in Gambia last year. Yeah. For $6, a diasporan could get monthly medications delivered anywhere in the Gambia, right? So that's one aspect that they get. And the third aspect of the care that's often forgotten, we put it under a general wellness bucket. That includes a nutritionist being part of the care team, a physical therapist being part of the care team, now even a clinical psychologist being part of the care team. So one plan that costs less than a cup of coffee a day for a lot of people in the diaspora provides everything somebody with a chronic condition needs without needing a hospital bed. And that's why we're always honest with people. If a hospital bed is what you need for your loved one, the reality is you came to us too late. Because in Africa, most people, by the time you need a hospital bed, two things are going to happen. You're probably not going to make it, or even if you make it out of the hospital, you never live to be 5-10 years, right? So most people in Africa have a relationship with healthcare in a time of crisis and emergency. Yeah. That's why even if you hear people say healthcare is expensive, I always challenge them and ask them when. When is healthcare expensive? Because you could get your blood pressure checked for free of charge. Even if you're hypertensive, you need just one medication, maybe two, at the worst case scenario, 3, once a month, take it at the right time, right? So our plans just created a vertically integrated solution that we package to a healthcare, to family members and the loved one. And to us is that feedback loop. How much information are you getting? Because as we know, all of us have had moms back home that would never tell us how bad it is. Yeah. If their blood pressure is close to stroke level, they'll just tell you, I just feel a little bit tired, a lot of stress, right? So subjective information has always been what has flowed back to people in the diaspora, where with our plans now, there's objective information that is coming back. Yeah. And I tell people the most powerful aspect of our care plan is the attention that people's loved ones get. Most people may overlook it, but it's very common for an elderly woman who lives in Africa to go months, days without physical contact, somebody actually touching them to see if they're doing okay. So psychologically, just having our Innovarx team come to their house where it's most comfortable, at the time that is most comfortable, just to check their blood pressure, ask them, how are you doing? How's your meals? That is it's a deposit into an emotional bank account for these loved ones that you cannot put a dollar figure on, right? So that's the experience that's been, and it's a lot of things that we had to bundle together, which is why it's very difficult to do, but also it puts us at an advantage because it's very difficult to replicate, because to vertically integrate all of that care and package it the way we have, I think has been of tremendous value for the diasporans who have also been very patient with us. Because like any business, your minimum viable product is what you roll out, right?
Yeah.
So what they don't know is everybody's initial care plan members, their experience is maybe 100 times better today because we're constantly iterating, constantly finding ways to add value. But that's what it's been. And I think until there's another solution, our comprehensive care plan, RX Wild Pass for prescriptions, you can match the value that it's providing in the Gambia. And we look forward to extending that value to other African countries as well.
Yeah, I really appreciate the breakdown of it. Right. I speak to a lot of people in the diaspora, and even before we started Fleri, I remember I'd started to message about 400 people over the space of 2 days, asking them, like, this is a problem. Like, is it a problem for you? And you will start to hear the stories that every person has, right? I'm in the Army, and so I met a gentleman, right, who for 6 months was deployed, but his family back home, right, was asking him to send money for his mother, when unknowing to him, his mother had already died and had been buried, right? And the money was just going, and they had figured out, like, this is a pipeline. So long as we keep it going, this money is going to flow. Because all they said was your mom is really critically ill and in the hospital, right? And there are others who sent money to get, you know, their fathers and grandfathers access to care, only to come home and the old man is blind because he had untreated hypertension, right? That had later caused blindness. And so many of these stories circulate within our circles and circulate within our communities, and we don't really see the effect of it. But the work that you're doing on the ground, and when we speak to communities, it's the reason why you spend so much money and you don't want to think about it, because they always say, oh, I don't even want to calculate it because it's like a lot. But it's always because we're the last people to be called when the emergency has escalated. Because they're going to start with, oh, can you go find some herbs from the village for grandma, right? Then it goes on to, oh, let's take her to the local doctor who's around, or the local hospital, and then see. Then she gets a list for medication. Okay, which ones can we afford? Which ones can we not afford, right? And then they start cherry picking as if like they're actually picking fruits and not the medication that the person is going to take. Then it goes on to, no, it looks like the case is worsening. We need to take it to the general hospital or the government hospital, right? So at that point in time, let's call Big Brother and then ask him to send money, right? And it's constantly the repeating cycle that we see over and over and over again, right? Whereas when you look at the work that we're doing with folks like yourself and others, right? When the beneficiary wellness report goes out at the end of the month, we almost always have people that start calling. So you just told me that my mom fell. I spoke to her a week ago and she never mentioned it. You know, what's going on? Like, are you making it up, or is she making it up? Which is it, right? I had one gentleman, his wife went to visit his mom at home, right? When she left, she was like, your mom is not doing well. But dude has been getting calls talking to the mom all the time. And it's almost as if we say it unconsciously. Oh, I'm fine, my son. I'm fine. Everything is okay. We're good. And over the course of the last, 3 months, we spent close to $1,000 in medical care shuttling back and forth because there were so many things that had not been treated that nobody really knows until they start getting a nurse going to the house, seeing them, and they realize that they now have a new level of trust and they start to unearth what's going on. So I think it's
Absolutely.
really imperative that when we connect, we really talk about the tangible nature of preventative care, right? The level of trust that comes from attention, right? The reason why care coordination is important, the reason why we assign dedicated family care reps is because having someone who's constantly calling, and that's all their job is, to call, engage, right? You start to unearth things that would normally not have come out in that way.
Absolutely. Absolutely. And just to add to that, how Africa still hasn't evolved where information and digital health is mainstream. So every single stop that you mentioned, even on the receiving end, those clinicians are starting from scratch, or they're working from a place of medical blindness because they have no history as well too. So it's mind-blowing how many outcomes and how much time is typically wasted to have a clinical intervention because of the fragmented nature of healthcare. And at every stop, there's no information that is being transmitted digitally or made available for the clinician to have the most recent quality information to make decisions on.
Yeah.
So, and I think even on the African continent, a lot of professionals get a bad rep because, quite honestly, most doctors, most physicians, most pharmacists, you're always operating from a place of medical blindness because there's no continuity in a patient's history. So their kidneys could be failing, but you don't have that information. They show up, you think it's diabetic, you put them on a medication like metformin, which you cannot put a person on if their kidneys are not functioning well. So add that to the complexity, it just makes it very, very difficult as well too. But I think it's so important. But I think always pivoting from identifying the problems, any African healthcare professional, every patient could tell you what the problems are, but slowly tackling and trying to eat that elephant of a problem by providing tangible solutions that you could deploy rapidly and see a response. I think that's where our bread and butter is going to be for the next 10, 20, 30 years.
It's really, really incredible to see that. And I'm about to jump into the actual plan, Assurance Care, and then have you talk to the Innovarx Assurance Care product that today, anybody that has family in Gambia can be able to acquire for them. And maybe you could start with an overview of what the intent of the product is, but then dive into the basics of the plan itself.
Yeah, the intent of the plan is actually, we don't sell healthcare, we sell assurance. We sell peace of mind, right? At the core of it, that's what the plan does. And I tell people, I designed the plan from a perspective of a pharmacist who's been sitting on the bench relating to patients every single day to understand what is needed to keep somebody out of the hospital. And that's why this plan is very specific to somebody who has any condition that you need to take a medication every single day. And you need somebody who knows and is equipped to kind of have oversight on you all year round, which is why we actually called it an assurance care plan, right? So the key features of it is we also build the patient-centered care model. It may be foreign in an African context, but in the USA, there's always this concept that a patient gets the best health outcomes when if you put a patient in the middle and then you have a doctor of medicine, doctor of pharmacy, doctor of physical therapy, a nutritionist, a nurse, an entire care team around it, all focused on creating best value and best positive health outcomes for that patient. That's what the model entails, right? But so the first thing we do typically is get your baseline assessment. Where are you from a healthcare standpoint? It's always like the onboarding experience that comes along with it as well too. So we do a couple of things. We run through a comprehensive wellness screening, which is very similar to a physical exam to get all your baseline levels. If you're diabetic, how bad is it? If you're hypertensive, how bad is it? How are your kidneys functioning? How's your liver functioning? Just to get to see where you are. And then we assign you to a care team that includes a primary care doctor, a nurse who builds a relationship with you as well, a pharmacy team member, and then we start your care. So from a care standpoint, we make sure if we need to do routine checks like monthly vitals, the plan affords you the ability to stay at home and we come to you to check your monthly visits. Sometimes that will include a nurse. Sometimes it could include a nurse and a nutritionist if you have a condition like diabetes, hypertension. And then the pharmacy provides up to 4 prescription medications at no cost that are delivered every 27 days of the month. And these medications are obviously sourced from the USA, the US generics. So once again, going back to how we designed it, the pharmacists are influencing the choice of medications, which is how it should be. And also because we have the routine monitoring, we're able to adjust doses, add different agents all year round. So the goal is always 2 things: always know where the patient is from a healthcare standpoint, and also make sure they get their medications on time every single time. So we have very high adherence rates, higher than the USA average with people from our care plan, as well too. And from a feedback cycle, every single clinical encounter, the customer or the sponsor keeps getting feedback sent to them in forms of a report. This is what's going on. Mom is doing okay. She's taking her medications. We've advised her to lose weight. The nutritionist has told her to switch rice and use something like Fornia. So it's very holistic as well too. But the last mile delivery, I think, is the value proposition, because Gambia, majority of the people live in the urban area, but a lot of the diasporans are success stories, being that they came from the villages. So gone are the days where their parents have to navigate to the city to get care, where now, and it's on even available online, our care providers, our drivers are going to every corner in the Gambia to deliver monthly medications as well too, all for the same cost included in the care package. So it's very all-inclusive in that nature.
Yeah, and I love this for all the folks that think of their family members there, right? And like you said, if you wanted a blank slate, right, a country where you could cross end to end, right, within a day, a lot of things become possible in that test demographic that you wouldn't be able to achieve in Nigeria as a test basis. Right. But also it allows you to be able to see what response is in rural areas, urban areas, and all of that. Right. And so we try at Fleri, for instance, to ensure that when we start talking to a partner, right, we're very clear about what that coverage is. And Gambia is one of those places where, I'm extremely delighted about how you've gone about it. Right. Most people start with, here's a sliver of the care that we're going to do. We're only going to focus on long-term care, right? Which leaves all of these other questions that people are constantly asking. Hey, what are we going to get if mom needed medication, right? Then that becomes another solution provider. And so in all the countries that we've been in, Fleri is always tactically looking at, what we call percentage of coverage, right, as a key metric, right? And as a base goal, we're trying to achieve 50% coverage, which means we have access to a telehealth provider, prescription fulfillment provider, comprehensive care provider with hospital network accessible, and then a home care provider, because we saw that these 4, right, would allow you to cover about 80% of what the market is going to need, right? And then we start going into all of our specialty care, mental health provision, cardiovascular, diabetic, specialty care, emergency response in that end. But what you've been able to do over the last 10 or so years, right, is incredible in the sense that you've managed to piece together all of that. And I have to say, the one country where a single provider provides all of the touch points that we need in order for us to be able to achieve coverage in the country, right? And that's significant. It's not easy at all to do, right? But it's part of the things that really delight me about our partnership. and why I want to be able to see that model roll out in other countries as well.
No, without a doubt. And I think that the unique advantage that the Gambia pilot has helped us do is like we could now circle any area that's, let's say, 2.5 million people in a country and just know that we need one lean facility to serve that population because we already know how far out our reach is. So if it's like, hey, you have 200 million people or you have 20 million people, okay, we need 10 Innovarx infrastructures that are all connected as one ecosystem, and it's the exact same playbook that we execute. But once again, it's just the thought process that went into it. We built the model for almost 5 years before we even started in Gambia as well too. So every single aspect of the execution is well thought out, not from a business standpoint, which is helpful, but more from a clinician standpoint, because we understand that, hey, the moment you need a hospital bed, we cannot help you. But from a healthy individual up until somebody who's sick enough to need a hospital bed, we could occupy that space and execute it in a way that's integrated, that hasn't been seen, at least in the Gambia as well too. And we're really trying to push the envelope and just hope that more people see the possibilities that this kind of agile model could really be for the continent for the next 100 years as well too, because that's the plan as well too. That's definitely the plan. Africa hasn't had its CVS yet, hasn't had its Walgreens yet. There's not a single health ecosystem on the continent, so that's always been our true north.
Yeah, I'm really, really excited about what the future holds. The continent with the most potential, the continent with the youngest people, but it's also the continent that has so much more to safeguard, right? That population, that opportunity, that potential, right? To actually safeguard it and make it a reality, because it's not a reality yet until we're able to harness it, right? And the work that has to be done, I think, people need to see that you can't have the continent with the youngest group of people who are constantly sick, constantly malnutrition, constantly going to the hospital, constantly at home calling off. That's an unproductive, huge number of people, right? And wasted potential. So truly appreciate you being here. It's been an honor and a pleasure to be able to walk through the work that you've done. You had so many pathways to go, and I'm still looking forward to meeting your sister, by the way. So many pathways to go, but you are truly placing country first, right? And I hope that people go look at some of your videos, right? Outside of just the work that you're doing, there's also the mindset shift that needs to happen for all of us, right? In the call to go back home and to go do that work. It's not easy, but if we condition ourselves and we connect with people who are doing it, I think we'll start to realize that there is a pathway to success in building our homes up.
No, absolutely. And I really mean it when I say we're cut from the different cloth. I think we have a very golden opportunity ahead of us. It doesn't have to be everybody. I'm a firm believer that 10% of dedicated individuals could transform the continent for the next century, because we're still a very young continent. A lot of countries in Africa haven't celebrated 70 years of independence, right? So too many times we compare it to countries like the USA that's 400 years old. But also because we haven't really had a heightened level of awareness and consciousness where we realize that we can't do it alone. We have to do it together. We have to consolidate our resources. We have to reattach that intellectual might and deploy it on the continent in a way that adds value, in a way that creates wealth, keeps the wealth on the continent. So I'm just honored, and I'm really proud of you. The moment you said what Fleri was out to do, I realized what role you could play. So we're only as good as you guys are as well. And I think we take it as a sign of trust and trusting the patients that come across to your network in our care. So in return, we just have a huge responsibility, not privilege, but responsibility to ensure that we restore dignity back into the lives of people that look like our moms, our dads, our uncles, and do it in a way that's not less than from a quality standpoint, but it's something where people even will come back from Africa and brag about the experience from a healthcare standpoint that they receive. So indebted to you, man. Thank you. And I look forward to all the amazing things that Innovarx will be doing with Fleri, because we also want to be a success story for Fleri as well. So it means a lot. It means a lot.
Yeah, truly appreciate it. Doc, appreciate it so much. Thank you very much for gracing us with your presence. Looking forward to the work that we're going to do. Thank you.
Likewise, yeah.
All right, so this is it. Episode 5 of the Fleri Care Digest. We've had the pleasure of speaking to Dr. Ismail D.Badije from Innovarx. They're bringing mobile delivered care to the doorsteps of our loved ones in the Gambia and truly throughout Africa. Catch you on the next episode. Thank you very much.